Hey, everybody, I'm Laura Kusumoto, like she said. I'm a consultant. I'm dedicated to helping to develop practical innovations that get adopted and used, particularly in healthcare. This is my 5th year of coming to IVRHA, and I really love this community and appreciate what Bob Fine has done to curate this show for 10 years. I call it a show. Each year there are new developments at IVRA, regardless of how the market is doing. It's growing slow, it's growing fast, but there's new stuff constantly coming. And and this year, it's this one, for me at least. One of them is smart glasses. Have you guys noticed how smart glasses are getting a lot of attention and hype now? How many people here own smart glasses? Maybe 10. How many of you wear your smart glasses today? Not me. I brought them, but I'm not wearing them. Maybe 2. Okay, informal 20%. So you might have seen on Super Bowl this year, there was a pretty thrilling ad from Meta for their Meta Oakley glasses, right? So that was pretty exciting. And it is getting consumers really interested in them. And smart glasses, not just the Meta ones, but they are in fact becoming popular with consumers. More and more people are buying them. They're being released not just in the United States by American companies, but big Chinese companies are going after this market as well. They're starting to integrate it with apps like Alibaba for commerce and so on. So given the market and tech signals that we're seeing, these glasses are going to be everywhere. Okay, you've heard that before, but I think it's true this time. So why do we want to talk about that at the International VR and Healthcare Association Symposium, huh? Are they smart? Are smart glasses even related to VR? Do you guys know? Are they spatial? Can they deliver immersive experiences? Well, I'm going to make the case that they do, but I'm going to contrast them and compare them with actual VR and AR. And I consider that these glasses' most basic feature is that they deliver AI to the human head in natural language. That's pretty immersive right there. And I'll get more into the weeds of definitions in a minute, but consider for a moment that you embrace smart glasses XR technology. They solve problems that VR headsets cannot, right? Adoption of VR the headsets has been a major barrier to the adoption of applications. VR interrupts your workflow. It puts you in a special place. That's its strength and its weakness as well. So they're not the same, but there are some overlapping use cases that we can talk about. So for the remainder of this talk, I'm going to give an overview of smart glasses. I'm going to talk about some healthcare use cases, of which there are many potential ones, many of which are already being tried and experimented with, and then some concerns that we might have about using them in healthcare. So let's go ahead with our overview. So this is the fastest growing XR wearable product, okay? And the definition is that it's a wearable internet connected eyewear that integrates computing technology, including heads-up displays, cameras, microphones, sensors, and many of them function as a smartphone or extension of the smartphone or computer. They also have frames or lenses, of course. They are glasses. And I love this quote from Mentra Labs. Today, we pull out our phones hundreds of times a day just to connect our eyes, ears, and senses to the digital world. Smart glasses make that connection seamless and natural. Consumers are buying. So 2024, about 2 million were sold. And before that there were some previous generations, by the way, Google Glass and some other more pro models have been out there selling in small quantities. Last year, 2024, about 2 million. 2025, it doubles to 5. 2026 doubles to 10, and so on, with a 15.2 CAGR percent. And there are but this is really only looking at the current entrants. There are new entrants coming. Google and Samsung together with Android XR. There's Apple, Amazon, Echo Frames, Xiaomi, Neo, Even Realities, Snap, X-Real, and I left out a whole bunch. So there's a lot of these smart glasses coming out. And even Meta has apparently ordered more components than would fulfill these 10 million glasses. So it's probably, unlike most VR forecasts, this one is probably pessimistic. So what are these glasses? I've broken them down into AI glasses and AR glasses. You will see other taxonomies. I apologize that you need very smart glasses to read these small text. However, they all have that glasses form factor. They have built-in speakers and microphones. They have wireless access, mostly to your phone, but some to Wi-Fi. They have 2D heads-up displays, some of them, that's optional. The optional also some vision correction, including electronic vision correction in some of them. Optional controllers like bands and rings that you can use to interact with them. Often they're used like earbuds. That's how I use mine. Taking photos and videos while you're walking around, being able to talk to an AI chatbot, which is both interesting and concerning, navigation, wayfinding, translation, captioning out in the real world, super useful stuff, and maybe facial recognition. That's going to be controversial. Then there's AR glasses. These more have the depth and the 3D spatial displays. They tend to be more bulky because you need a different kind of display in order to see the 3D and do the depth sensing. And their capabilities are a little bit different. They're more about mixed reality, but they also they have the navigation, the wayfinding, translation, captioning, etc. So these are coming out as consumer glasses, not just industrial ones. And in this talk, I'm not covering the industrial ones, such as HoloLens and some of the others that are out there for professional use as headsets. What hardware is on? I know you guys didn't come here to talk about hardware, but it is fascinating that if you look at this exploded picture of the glasses, there's a lot of stuff in there, including starting with 15 to 20 integrated circuit chips in the glass, right? That's a lot of electronics in there. There's microphones, the speakers, as I talked about before. Anywhere up to 3 integrated cameras in the glasses. And then there's different kinds of displays, the micro LED, OLED for the AI glasses, and then more complicated ones for the AR. You've got Bluetooth, you've got Wi-Fi chips in there, communications with the controllers if they have them, and then all kinds of sensors, accelerometers, gyroscopes, magnetometer. It works for sensing head movement and so on. And in the future, mostly experimentally right now, in the future, there will be some biometric and interesting stuff, heart rate, gaze, eye movement. You hear Walter Greenleaf talking about how these will be used, how they can be used in VR. They're coming to the AI and AR glasses also. Environmental sensors, how hot and cold is it, and stuff like that, and LiDAR. But most of these glasses don't have these capabilities just yet. And it's mainly because there's only so much stuff you can cram in the glasses, really. There's software that is devoted to the smart glass segment. And this is important because these companies want to develop an ecosystem of applications. This is our opportunity, folks. We can get in there and develop applications that are suitable for healthcare. So there's operating systems. There's a lot of stuff that's in firmware, but there is the Android XR operating system coming out from Google and Samsung, and there's the Mentra OS, which is an open source operating system for the open source hardware that company is developing. There's a lot of Gen AI models that you can tap into. A lot of these vendors are locking you into a specific AI model for the AI agents that you're talking to. However, like HTC is making that configurable. So that's something to look for, is which AI models you can connect to. On board on the glasses, there's a little bit of processing going on, but a lot of it happens out on your connected device, whether it is your phone or your computer. But on the device, for example, the wake word, hey Meta, it detects that on the device. Certain things have to happen really, really fast. And they try to put that on the device, both for the speech recognition and vision recognition. And then there's some storage on board to capture those photos, videos, audio, and keep it there until it can be transferred. off to the cloud or to your device. And importantly, there are SDKs. Meta has one. There's a Solos Smart Glasses SDK, and there's a Vuzix one. There's a whole bunch of different SDKs. So that's really key for developing an ecosystem. So as we think about virtual reality versus AR and AI, we really have to think about all these different trade-offs. I'm not going to go over them. I'm going to try to speed up a little bit here. So let's go on to healthcare use cases, which I've grouped here into assistive, clinical care, and training and education, partly based upon who's the primary user. Most of the examples I am giving in the following slides are already in use somewhere, experimentally or in research. There also has been formal research on the use of smart glasses in clinical care. Not a lot of it, but it tends to be based obviously on older models of smart glasses, such as Google Glass, Vuzix, RealWear. Some really good results from them, but we don't have a lot on the new crop of smart AI or AR glasses. So let's move forward. The assistive category, this is used by patients, consumers, caregivers to support daily life and health. And so this can be an adjunct to actual healthcare and health and well-being. Some of the applications that have been identified are dementia, obviously being able to recognize objects and people in the world, being able to call for help with live assistance. And there's actually a program, there's an Alzheimer's Association program looking for innovations. And one of the innovations submitted was the yellow brick road for smart glasses that will help an older person find their way back home. Hearing loss, this is going to be huge once it starts working well. Being able to just give a transcription on a display of what it is that people are saying, and also speech isolation using those microphone beams to be able to isolate the speech out of the rest of the noise, which is a big problem for people with hearing loss, vision loss. Already people are using this for narration, the scenery around them, wayfinding, and calling for live help. Diet management, the usual stuff that's on your phone, now part of it can come to your glasses, including hands-free recipe preparation, and medication adherence. And another thing to think about, glasses do get lost. Yeah, people take them off and lose them, but might be a little less easier to lose than a smartphone. If you've ever worked with an elderly person, these things tend to get lost. At least the glasses are worn. So in the clinical side, there are a number of applications and really starting with the Google Glass, famously Dr. Raphael Grossman did the first live surgery with Google Glass back in 2013. And ever since then, the potential applications have been proliferating, especially now that we have more AI in healthcare practice, right? Healthcare is the fastest industry in the adoption of AI. So those clinician notes that are being taken by the ambient transcription, they can now be captured on the glass. That's another option for capturing them in addition to the phone and the computer microphone. There also can be, and it can be visual, so visual notes can be taken. Remote assistance, call for help. If you are sending, say, a medic or someone into somebody's home, or an emergency response person can get help because somebody in a call center or a doctor can see what they're seeing and can help them. Doing assessments, as Walter talked about, the video stream can go into an AI that's doing analysis. Medical rounds is a fantastic application, being able to go and just be able to stream the medical rounds in various parts of the healthcare establishment. Training and education, this applies to both healthcare professionals and patients. So there can be sim-based learning. Think about using the mannequin, but having additional information delivered by audio and maybe partly with the display. Remote observation. This has been, since Dr. Grossman's first application, I read about students at USC are using this too, that they're watching live surgeries that are being streamed out of Meta Ray-Ban glasses. Now, of course, they have to deal with the HIPAA concerns so that nobody's identity is shared, but it's a great way to learn. So all of that said, so there's a lot of benefits, a lot of potential applications that I think are really, really exciting with limitations. It's not the same as VR, but there's also some real life considerations. This is where we have to get real about what does it mean to really implement these things. So even looking at this picture, can you imagine sitting in your doctor's office and there's, you're wearing smart glasses and they are too. What kind of conversation is going on there? What's going on in those glasses, right? Well, again, you will need your smart glasses to read this eye chart here, but I grouped it into compliance, convenience, and cost benefit. We can split it out in many more different ways. But I think obviously patient privacy is a huge issue. I'm not going to read all of these, but the personal health information, of course, an image is personal health information. And if these clinical notes are being taken in glasses, there are HIPAA concerns. So where that data goes is really, really critical. But there's also employees' privacy. So I was reading on a nurse leadership blog about how nurses are starting to see some of their own staff and patients walking into the clinic or hospital with these glasses on. Okay, what's happening there? Are they recording? Are they interpreting? Are they broadcasting it on live feed on Facebook, which is possible for them to do? So what are the policies going to be in healthcare for the use of these glasses, right? And if they are used for any kind of clinical purpose, they need to be cleared in a regulatory sense. And I was telling somebody the other day, this is, as a new technology, when we start using it for serious purposes, it breaks guardrails in novel ways, just things we didn't think of. Not all of this is intentionally bad. It's just we didn't think about it, right? On the convenience, so there's many different regulations and IT security concerns and all that. On the convenience side, wireless doesn't always work that well in medical facilities. We have that problem with VR. That is going to happen with smart glasses as well. Battery life is a concern. The batteries go out halfway through the surgery or halfway through your workday. Comfort is easier with the glasses than headsets, of course. Appearance is going to be cool, so you don't have to worry about that. Are we going to share these devices or are we going to bring our own devices? That's a huge question because, let's say you're the device police in the nursing ward and one of your nurses shows up with these glasses. What do? You tell her, I'm sorry, you can't bring your glasses in today. Well, what if they need them to see? So there's some complicated issues there. Back-end integration, of course, and workflow integration. On the cost benefit, I put the benefits have to be proven in healthcare for a new technology. And so, the fact that you might get higher efficiency with note taking through glasses and all these other things will have to be shown. The new interventions will have to be proven. And the prevention benefits by having the patient having these things at home will also have to be proven. And that will all make it worth the cost of purchase, maintenance, upgrades, negotiating enterprise contracts, the opportunity costs, and just the cost of changing anything in healthcare, right? So that was kind of a whirlwind overview of smart glasses in healthcare, and I hope this starts a conversation of how this is related to what we're doing here at IVRHA. If you have comments, questions, I welcome. I would love to talk about this some more. There's my name, information, and I welcome questions, comments.
We have time for questions. Thank you. Does anybody want to get to the mic and ask Laura a question? Dr. Greenleaf does.
Well, thanks, Laura. I haven't had a chance really to explore smart glasses. I'm curious about the spectrum of immersion that you think is going to be possible. Will we be able to use them in a semi-immersive way clinically and as some of the applications you described?
I think that certainly the AR flavors of these glasses are going to provide more immersion because there's more awareness of the depth and the space, the spatial awareness that they have. But it's not going to be as good as the AR headsets that are more fully equipped. With time, these things, I believe, will merge. But in the short term, I think if you want something truly immersive, you need to go to the AR headset or to the VR headset. And for these, we should look at applications that need just a little bit of digital information mapped on the real world, and where that is sufficient to create some of the benefits of these applications. So I think it's on a spectrum. And we've added one more thing in the spectrum between VR and just being there in reality.
Yes, in a similar way, I'm curious about the degree of registration you see with the glasses that are here now or soon to be out. How precise will they be in terms of looking at an object and lining up with it?
Exactly. So I do not believe that the AR glasses that are being made for consumers will be adequate for precise operations of any kind in factories or in medical. They just won't have the hardware on board to be able to do that. So you still will need to be looking at the high-end professional that are coming out, and everybody's mourning the loss of HoloLens, but there are new things coming out. So I really think these are going to have a niche where it's a little bit more language based, a little bit more, and or the precision isn't required. So as an example, there have been experiments done helping people with shopping. The things on your left are oranges, the things on your right are apples. It doesn't have to tell you within a millimeter where it is.
Okay, thank you.
You're welcome.
Great. We have some more. Go ahead.
Hi, Laura. Thank you for the great talk. So I'm curious. There's a lot of rumored momentum around wearable like AI pendants. Thinking about Humane being purchased by HP. Thinking about like OpenAI and Apple around pendants, or even just other wearable devices, and bringing in vision and other modalities into there. This might be a talk for a future IVRHA,
Yes.
but I'm just curious to gauge your thoughts. Where do you feel like that kind of fits in with the momentum around AR glasses? And where do you think the contrasts or comparables are?
I think that other worn devices can provide significant functionality as well. And so this is where I think, in this community, we're always going to be thinking about what is our purpose? What problem are we trying to solve? So some of them might be better solved, not worn on your head. Especially if you're mixing the glasses with your prescription glasses, then it might be better to have the sensor array on something else. It's not on your glass. So I also think there's a lot of promise with lapel worn, and of course wrist worn is already a well-explored area. The advantage of the glasses, though, it does bring it to your head. And there may be other things that bring it to your head. It might be strictly earbuds that become smarter and smarter. So I'm not sold that glasses will be the only thing. I think the coolest thing will be, they have a system on a chip, and then you've got your phone there. The phone will eventually go away. It won't be necessary, but right now it is. So you've got 16 ICs on your head. You've got your really supercomputer in your pocket. Yes, it can take other sensors, input from other sensors. So I think that's a very creative area to explore.
Right on. Thank you.
Yeah.
Great presentation and overview. I thought when you showed the BYOD part about the potential for PHI, I know when I'm wearing them and I'm trying to do different things, it's so easy to take a picture, and the
Yes.
picture can capture PHI. So just
Yes.
a kind of a BYOD policy ad, I guess. But on the deafness, and I've tried them in the closed captioning or whatever you call the captioning, and it comes up pretty accurately, even in the different languages. And it seems to be more beneficial for deafness than I think I don't know if anyone else has had experience with that, but it seems that you can be reading, even in a loud environment, you're facing a person. It's picking up all the words. You can just read what they're saying.
And I think that the value of bringing it to your head really makes a difference. There are many mobile phone apps that will do transcription for you. Say you're sitting at a dining room table and everybody's talking, and they'll transcribe that, but that's on the table. So the person who's suffering from the hearing loss and can't necessarily hear the conversation around the table, they have to look at their phone. And usually it's also very setting up those apps and everything is pretty complicated. But having it wired to deliver to your head while the conversation is happening is a much more natural experience. And NLP continues, Walter was talking about Moore's Law for NLP, that continues to get better and better, as you're pointing out. So that transcription ability. And one more thing, they are designing these microphones to be able to isolate sound, which is something that hearing aids are better or worse at. So I think there's a lot of advantages there.
Yeah, I think it's going to be a revolution
Yeah.
like we've never seen.
So I have a question regarding how much assistance is too much or too early. Meaning, is there any, well, using the yellow brick road example, there's something to be said for cognitive exercise, and if you don't use it, you lose it. And perhaps even at a younger age, if you're just handheld throughout life, uh, do you lose a lot of mental fitness? And in the literature, is there any discussion about when to start that sort of implementation or when might be too early?
I think that's a fantastic question. And I hate to compare it like this, but I was telling the Uber driver yesterday what I was going to be talking about. And he said, "Oh, can these be used for my kids?" That was the first thing that went to his mind. And I'm saying, well, I'm not sure you want your kids to be guided through life and not learning. And I told him about the mobile phone bans in schools for various reasons. So I think it's a complicated question, and I'm not aware of research, but I'm sure we should be looking at it, especially when thinking about applying it to education and applying it to actually to adults too. So
Yeah,
how much help do we need getting around in this world?
right. I think the earliest stages of dementia might be a critical time to keep that fitness level high.
Uh-huh.
So that the yellow brick road example is it's a very wonderful prospect and opportunity for longer independence. But then the question is when to start applying it.
That's an excellent question. Thank you.
Another round of applause for Laura. Thank you so much.
Thank you.